Welcome to my back pain page. These are a few exercises that I like to give patients to manage or control lower back pain. This is for informational purposes only. This video does not substitute an actual evaluation and treatment here at Dr. D's Physical Therapy, and always consult your physician first before trying a new exercise regimen. So let's get started. This exercise, we are actually going to start on our backs. We are going to start by using our transverse abdominis muscles. So the transverse abdominis muscles, they start up here around or right under the rib cage, and they go all the way down to your pubic bone. There's 3 sets of these muscles, and they are the deep abdominal muscles that really help give support to your lower back, your bony pelvis, and hips. So they really are the ones that get no glory, but the ones that we really need to have a happy lower back. So for this video, I'm going to have you go ahead and lie on your back. Your knees are about hip width apart. You're going to take your 2 fingers and you're going to place them on your bones here. And then you're going to slowly just move them inward, and you'll be able to feel the muscles here. Now, with your transverse abdominis tightening, you're going to go ahead and breathe into your nose, and then as you exhale, you're going to try to draw the fingers away, draw the muscles away from the fingers, okay? I'm going to move my hands so that you can see what I'm doing here. And I'm going to back up a little bit. First, you want to make sure you're in a neutral spinal position. Posture is so important in everything that we do. So if you're a person that's more anterior or forward, you're going to be like this. Your back is not going to have a lot of contact with the floor. Or you could be a person that's a little bit tucked under too much and your butt is really contracting here. You don't need that either. You need to be right in the middle. So first, let's rock forward and then back, and then stop right there in the middle, okay? All right, so we're gonna take that breath in, and then on your exhale, draw those muscles in. I like to think of like a diamond of everything coming together toward the center of my abdomen. So let's try 10 of these. That's 1, 2, 3, still with me? 4, I'll put my hands here again. 5, 6, 7, 8, 9, 10. When you're doing this on your own, I like you to do either 2 sets of 10 or 2 sets of 15. The next one that we're going to do is simply called trunk rotation. So we're going to stay in this position, which in physical therapy land we call this hook lying. So you're going to stay in hook lying position, but now you're going to bring your feet and your knees together. You're just going to put your arms by your side, whatever is comfortable. And very gently, we're going to let our our knees go over to the left. And then over to the right. The purpose of this exercise is just to get some nice, good movement that is pain-free for your lower back joints and muscles. It's a good way to start your day in the morning, doing trunk rotation, just to warm things up a bit before you get out of bed. All right, I think we've done at least 8 of these. We're going to do 1 more on each side, and then I'm gonna move on to the other exercise. Now this next one is one of my favorite exercises to do. It really opens up those lower lumbar vertebrae, but you also get a nice little stretch of the outer hip and a little bit of your hip flexor muscles too. So for this one, you're gonna bring your arms out like a T. I'm gonna have us straighten out the left leg, or excuse me, the right leg. We're gonna bring the left leg across the body, take the right arm, and give it a little bit of extra help. And sometimes you might even feel a little cavitation or a little pop. I just did in my lower back. It's not necessary. It's not anything that you need to make happen. But if a little bit of oxygen is released from the joint, moving in that direction is not anything to worry about. And again, for this stretch, you're gonna hold it for 30 seconds and you're gonna repeat it 3 times. And I always like to stretch one side 3 times and then I'll go over to the other side. So this time I'm not gonna hold the whole 30 seconds just because I wanna get to the next exercise and to limit the amount of time of this video. All right, so let's go ahead and switch sides. So we're gonna straighten out our left leg. We're gonna bring the right leg across the body, take the left hand, place it on the outer edge of the right hip. And then just for a little bit of added stretch, you'll turn your head facing the arm that is outstretched. And we're just gonna hang out here. A little frog in my throat. And we're gonna hold this position for about 30 seconds. If you've seen any of my other videos, I really like to emphasize on the breathing. So right here, you can utilize that rib cage breathing. Or you can use your diaphragmatic breathing. Or you can just breathe. All right, I think that's about 30 seconds. Remember, you're gonna repeat that one 3 times on each side. Another important tip for managing lower back pain is how you get in and out of the bed. So I'm already in this position. Let's pretend that this is a bed. I'm not gonna get out of the bed by springing up like this. That is really strenuous on your lower back. What you wanna do is you wanna roll over to your side and then push up with your arms to get out of that hook lion position. All right, so those are just a few tips for managing lower back pain. You can always give us a call and we can discuss your lower back symptoms further and even schedule an evaluation to evaluate your lower back and give you the best treatment options that are individualized to you.